So the best study that we can find to treat lower back pain is actually the patient who's sitting right in front of us. We will never find a research study that tells us how to treat lower back pain, and the reason for that is that because there is so much variation in lower back pain and how it affects people. So what the research does help us in identifying specific patterns of lower back pain, and then it alludes to some treatments that might be effective in some groups of people with certain symptoms, but that doesn't include everybody. So what we have to do is when a patient comes in, we have to ask them a lot of questions about that back pain, and then we have to do a very good clinical assessment to identify what movements exacerbate their symptoms. So now the thing that's really important in most back pain, even acute and definitely with chronic, is that your spine is designed to move. And then, so what we see that happens a lot with people with back pain is that for some reason they get the wrong message that they have to overprotect their spine. Sometimes the idea of bracing through the abdominals is overplayed, and it actually actually can stop people from getting better. So yes, core strengthening has some role, but your muscles in the front in your stomach are not the same as the muscles in your spine. So to get yourself out of lower back pain, you have to be able to move your spine again. And that can be a little tricky in the beginning because everything hurts. So what we do is we find ways of getting you moving that are not painful. And then as your lower back settles down, as the inflammation settles down, the pain settles down, then we can introduce more movement and then work on a little bit more strengthening. But the key is movement, because when you move your spine, you actually automatically use your core muscles. So your core muscles are also the muscles in your spine as well. So anyway, most important thing is after an acute episode of back pain, there's a brief period of rest, but brief, not weeks. And then it's a period of moving, a period of learning how to move again. With some disc injuries, the period of containing your movement is definitely more important, because we don't want to keep re-injuring that disc. So with a disc injury, there's certain movements that we avoid and certain movements that we encourage. Yes, there's lots of passive modalities in the beginning that can help to calm down the pain and help you get moving, but over-reliance on passive treatments is not a good idea in the long run, and that's what sometimes can keep people, can stop people from getting better. So anyway, if you, obviously in the pandemic, it's a little bit concerning coming in for appointments. We've made it super safe here at Pilates4Physio for coming in person. If you're really, really concerned, we can at least get you started virtually. So if you have any concerns about coming in for appointments, you just give us a call. We'll have a chat on the phone. As I said, we've made it super safe here, and hopefully we'll see some of you soon. Okay, stay well and safe. Bye.